Hello, I'm Sean Sung-won Park, prosthetic urologist practicing in Seoul, Korea. This is Scottsdale, Arizona. I'm here to attend the SMSNA meeting 2021. Yes, it's been quite a while I was able to attend the so-called offline meeting because for the past 2.5 years, due to the COVID, all the meetings were cancelled. For example, the AUA meeting 2021 cancelled just ahead of the 15 days. And many meetings suffered the same thing. So we were not able to attend the meeting like this for a good time. But as I experienced for the past 2.5 years, so-called virtual meetings, it wasn't that suitable for the meetings for surgeons. We need to see each other to talk properly about how the surgery goes. And when I do the lecturing, do the online meetings, it is not the same when I do the offline meetings. Because when I do the offline meetings, I can see the audiences and I can tell them and I can feel what they are in curiosity or whether they are understanding or not. So for this meeting, I was invited as a course moderator of the one session, and I was also invited for the cadaver lab sessions. But unfortunately, I wasn't able to join the cadaver lab because the COVID restrictions, regulations. So as I'm from foreign country like South Korea. So the session I moderated is about the difficult cases. Dr. Wilson made his name, named it as head scratchers of the IPP cases. So each of us moderators had to pick one of their most difficult cases throughout our IPP surgeries experience. So it was quite difficult. We all presented very, very confusing and challenging cases. There has been some changes with the protocol when IPP got infected. So back in the days, when IPP got infected, take it out and spend about 3 months and do the surgery again was a kind of textbook approach. But now many people are trying to many of us try to salvage it. We may take it out and wash it out and then put the new implant at the same time. That we call as a salvage. That method has been tried more than before, and it shows much better result than before. There is a trend that we treat infection of the IPP differently than before. So that's something I learned this time. And also there has been some updates with the new modalities of the ED treatment. Let's say ESWT or extra shockwave treatment or stem cell injections, all those stuffs. The SMSNA statement is still the same. It is still experimental treatment, and we surgeons shouldn't charge the patient with that treatment because we still do not know whether it will work or not. But even so, there are many articles and many presentations about the new modalities. Let's say a regenerative medicine. So maybe in the next decades we will be able to see some different treatment modalities in the future, but it's not yet here yet. Every meeting you attend, you will learn something. There are a lot of things you will learn. But for me, this meeting gave me reassurance that we surgeons need to meet each other. Because by meeting them again, I was able to feel connected, and I was able to retrospectively and objectively thought about what I have done with my surgeries, because I was able to compare how my surgery went with the others' results. That's the one thing I learned. I should attend this meeting regularly to update myself at the same time that I can check out myself, my surgeries, my practices. I started my prosthetic practice because I wanted to be like a Dr. Wilson. Dr. Wilson was a private practitioner as well when he first started, but he always attended the meetings, and he never be lazy about the academic aspect of our practice. He told me that, Sean, that's kind of a secret of the success. Well, at first, I just blindly followed his advice. But over the time, every time I attend a meeting, I was able to understand why he told me that. Attending the meeting is not just to enjoy your time. It's a lot of work. You have to prepare your presentations, you have to write an abstract, sometimes you have to arrange your schedule. But even so, in my eyes, it is one and the only way that you can learn from your peers. Surgeons, especially like myself, can easily be isolated from the society. They kind of blinded and think themselves they are the best in the world. Because we keep doing the surgery, and if they can't compare with the others, we can only see what we do. But after you attend a meeting like this, you can objectively reflect yourself. How you are doing, how the others are doing, and what I can do better on what I shouldn't do. Attending this meeting was able to sharpen myself, and it gives me a huge joy. But at the same time, I was able to meet my peers, my colleagues. They gave me more knowledge than before. They gave me more support than before. I was one of them. Like I said, prosthetic urologists are really rare breed. So it's really hard to find a good colleagues in this field. But they are here, and they are coming to the meetings. It's not just for surgical skills or something like that. It's one and only chance to fully dedicate yourself into the field of the prosthetic urology. I want to prepare myself to offer an updated and cutting-edge medicine to my patients. So that's the reason why I keep coming to the meeting like this.